Hello friends, fistula in ano or simply fistula is a very common problem that we get in our day-to-day practice. A lot of patients come with pain while sitting, some purulent discharge or pus discharge while passing stools, and generally these patients are suffering from fistula in ano. Today we are going to speak on sonography-guided fistula surgery. Now, fistula surgery is a pretty diverse topic. There are a lot of treatment options available, right from Kshar Sutra in Ayurveda to Set-on in allopathic practice. Then we can open the fistula, we can remove the fistula tract, we can burn the fistula with lasers or with different chemicals. This fistula tract can be repaired again and so on. There are a lot of surgical options available. We are going to specifically talk about how sonography helps us in doing these kinds of surgeries. So this is basically a sonography probe that is used in fistula surgery for doing a perianal sonography. Now this probe is eventually inserted through the anal canal of the patient. So this is the part from where we pass the stools. This is the large intestine going above, the bladder and the urinary tract. So we pass the sonography probe from the anal canal inside, and then we can see all around what type of fistula or abscesses are present in the patient. The probe that I was talking about previously, this one. So this is a biplanar probe. That is, it also gives a circumferential view as to what is present around all the directions, and also a linear view, as in a straight line what all structures or diseases are crossing the probe. The images that we find look somehow like this. So this is the anal canal through which we have passed the probe. Around that we can see this black area. So the red line is showing this black area. So this is the internal sphincter. So there are two sets of muscles surrounding the anal canal. One is the inner muscle, which is the internal sphincter, and then there is the external muscle, which is the external sphincter. The space between these two is known as the intersphincteric groove. The site of fistula, which is the most common, is the intersphincteric groove. So the concept is that there are many anal glands which are present, which secrete some substance for the lubrication of the anal canal. So these glands get blocked, similar to the blackheads that we find on our nose. When these glands are blocked, we have some swellings over the nose. Similarly, when the anal glands, their opening is blocked, then these anal glands get pent up secretions, the secretion cannot come out, and in those pent up collected secretions, infection occurs. This infection then bursts into the intersphincteric groove, and therein the fistula occurs. This is the fistula that can be seen here. So this tract then eventually it converts into an abscess. So this was initially something like this. After some weeks when the patient presented, so this is the intersphincteric groove, and from there it has gone even outside the external sphincter, and now it has caused a big abscess formation. This is a huge abscess, almost 30-40 ml of pus must be present inside this, and then it has to be drained. So sonography helps us to identify if there is only a fistula tract present or an abscess has formed, in what layer the abscess is present, what is the extent of the abscess, how far it is extending from the anal canal, and we can do a proper guided surgery leaving nothing behind. Thank you.